Okay. Hi, I'm here to talk about othered groups. And to start this off, we are supposed to talk about an othered group and kind of reflect on our own personal reactions when caring for a person. So, the group that I thought about for this was single parents. And I feel like this is relevant because I currently have clinical at Children's, and I see single parents sometimes and how they are interacted with by nurses and just professional medical teams. So, part of the so what's one bias you can identify that you hold about this group? So, I think for single parents, it's natural to I a bias I often think of is they may be low income and they may not uh, because of this they might not have the resources that their child needs. So they and this may show up as them not being able to be present. Um, and a bias that can often be associated with that is that the parents don't care, and that them not being able to be there or not being able to offer everything that they need is because they don't care. And this is bias because um, I think that uh, the reality for many single parents is they may not have the flexibility with work to have off. So, as a single parent, they may be the only income for their child. And so there's two levels to that. They might not be able to be as present in the child's life because they need to work one, maybe two jobs. So they're not able to, their child may need to be at daycare for 10 hours instead of 8, or when they pick them up, they're exhausted, or, they go to the doctor's appointment and maybe they miss appointments because they can't get off time work. And so I think there can be bias towards single parents that they don't care. Um, and so it also says, what have you witnessed in healthcare in the community about people of this group? So I've witnessed at Children's Hospital where nurses, when they're discussing single parents not being present while the child is sick, that it'll definitely be translated as they don't care or they're not good parents, and the nurses may roll their eyes or be frustrated or aggravated, or it may even affect how they communicate with the parents because they're not there, so they have to call them and it's an inconvenience and it's hard to pass along information and know if they cared they'd be here. And I feel that when you take a broader look at it, there's social determinants of health for single parents that are affecting their ability to be as present in their child's care. There's a lot of barriers that may be inhibiting them from being present when their child is sick in the hospital. They may have other children at home. They may be a single parent of two or three. And if one is in with tonsillitis and needs to stay overnight, the other two can't stay at the hospital. Um, and there may be like a social determinant of health. They may not have the social support. The other parent might not be in the picture, or there may be a reason that they're not involved. We don't know the context, and it could, maybe not, but we don't know the context. And same with family and friends. They may not have family nearby that they rely on, or they may have had a poor experience as a child, so they don't trust their children staying with other people outside of daycare hours. Like they don't want their child to stay at anyone else's house but their own, um, because they're afraid that something could happen, um, either an accident or something else to occur. And they're also monetary wise, they may not be able to have the time off work and they need to afford the hospital bills. Um, So those are a few things that I think affect why single parents may not be able to be there. And then uh, we also were prompted to look into the cognitive processing covered in the 2013 Krosky article. So this article is entitled Cognitive Debiasing, uh, Origins of Bias and the Theory of Debiasing. So this uncovers that there's two major sources of bias. Innate hardwired bias that develops into through evolution, it is developed, and then acquired bias, which is established in our development and within our working environment. So, in relation to this, I think in the othered bias group, uh, the bias is most definitely acquired. The the belief that the parent doesn't care and that's why they're not there, that's an acquired bias that we've come up with, and I think it'll affect how nurses communicate with the parents, our attitude towards working with the children, and it could even this could be subconscious or unintentional, and there is a higher burden of care when the parents are not present and the nurse is providing not only emotional support for the child but all the physical cares that are needed. And so it is a burden on the nurse when the parents are not present. However, there's it it shouldn't negatively be affecting the relationship with the parents, and we need to establish therapeutic communication with our patient and with our patient's parents, especially if they are too young to communicate it themselves. Another thing that this article highlighted that I think is very important is bias will come out during abbreviated decision making, and it may also come out during fatigue, sleep deprivation, and cognitive overload. So we may subconsciously be biased. It's a really hard work day. You have 4 patients and lots of things going on the floor. So the nurse may have unconsciously acted on their bias. And it's our job to try to recognize what are our biases, what do we believe, and how can we combat this. So if we are feeling overwhelmed or frustrated or we need to make a quick decision, not letting our bias affect how we treat our patients. And the last little bit to talk about is marginalization. So this is the article was the 2020 article, Strategies Used by Interprofessional Teams to Counter Healthcare Marginalization and Engage Complex Patients. So within healthcare systems, we often can struggle to provide equal care to complex patients because there can be overlap between behavioral, physical, and socioeconomic problems. And I think this is very relevant for single parents and how we communicate with single parents and the children in this setting, because there is a socioeconomic burden oftentimes with this, and there may even be emotional or behavioral barriers as well. So the child may have harsher emotions or be more scared, or they really want dad but dad's not there and they're frightened, and there's other barriers that will be added for these cases. So to try and equalize care, I think acknowledging your limitations and reaching out to other interprofessionals for help, especially if you see behavioral issues in the child. Even something like social work for extra resources where you see that this single mom is really trying her hardest, but she's barely, she should be on Badger Care, but she doesn't realize she qualifies. So speaking with social work, and that may alleviate a huge burden of cost for them. Or you see that your child has a nutritional deficiency. You can see in their BMI and in their physique that the child doesn't have enough nutrition at home. Speaking with social work, do they qualify for food stamps? Are we able to assist them with this? Are they aware of this? Are there other programs? And trying to work together to provide the best care and provide the most for all, even those who are marginalized, and attempt to offset the way that, and I think the way that we communicate with single parents, it's easy to get frustrated when the parents aren't there and it's difficult to get a hold of them. Maybe they're working all day and they aren't answering their phone, and you leave a voicemail, but the doctor relayed something to you, and the note says you have to call, and it whatever it may be, it may be frustrating, but I think it's important to establish good communication and try to provide equal care, and know that those parents do care too. They may be trying the best that they can, and there are barriers that are inhibiting them. And I can't speak to all parents, but I imagine most parents would do anything to try to be there as much as they could for their child. Um, so that is my little tidbit for um, the group of single parents.